All right. Good morning, everybody. Dr. Rafish here, Vet Triage. We're going to talk about spaying and castrating your pets. Um, we had a pretty cool project yesterday on June 20th in California, and more news on that later as things develop. But the main focus of that event in California was the neutering of pets. So we're going to talk about that now and go over some general guidelines for not just pet owners, but also for new grads. First off, some terminology. So the word neuter actually is for both male and female. So neutering is the act of sterilizing the dog or cat, and then neutering for males, is castration, and neutering for the females is a spay. Those are the lay people's terms for those procedures. So we often will use the word neutering to be synonymous with castration for males. However, technically speaking, as far as I understand it, neutering is actually for both sexes, and castration for males and spay for females. Now, for castration for males, the technical term for it is orchidectomy. It's orchidectomy. Orchid implies testicles, ectomy implies removal of. So orchidectomy, it's a bilateral orchidectomy, meaning you're doing it on both sides, assuming, of course, the dog does not have any congenital abnormalities with retained testicles or things like that. For the females, ovariohysterectomy is the term most commonly used, the scientific term rather, or surgical procedure. Ovario is ovaries, hyster is a uterus, and ectomy is removal of. However, ovariectomies as well, where the doctor only removes the ovaries, is also an acceptable procedure that can be performed to sterilize females. So ovariohysterectomy or ovariectomy are the two female procedures. So that's just kind of the semantics over the terminology, rather. Okay, so why even bother, doing this for your pets? So number one, and this is no particular order, but number one is population control. We clearly have an issue with too many dogs and cats, lots of strays. Shelters and rescues are our capacity, frequency, foster programs, and no-kill shelters, and everything else are tough to keep. They have very difficult times, impossible actually, to keep up with it. Hey, we have an audience member. Woo, welcome. Feel free to ask any questions you have. Oh, we have 2 audience members. Woohoo! Ask any questions you have regarding this or any other topic. So overpopulation in dogs and cats is a problem, and spaying and neutering is the solution that we have for it. It's not great in terms of what we're able to keep up with, because the dogs and cats will reproduce at a way faster rate than we can spay and neuter them. It's just not feasible. But it's an attempt. Unfortunately, I'm not really sure it's going to be the end all be all. We've been doing this for years and years, decades. We've been spaying and neutering without really much of a dent. So it's good, but it's not the magic bullet. So population control is one reason. Second reason is prevention of diseases and medical conditions. So, for example, for the females, you worry about uterine infections, so pyometra, which is infection of the uterus. You worry about ovarian tumors, cervical tumors, uterine tumors. You worry about the females getting pregnant, of course, obviously, uterine torsion. There are many, many reasons, some common, some uncommon, that you want to, for medical reasons, spay your females. And then for the males, obviously unwanted pregnancies, testicular tumors, prostatic infections, prostatic cancer, all these things are reasons. Now, some of these conditions are more or less likely to occur in an animal that has or doesn't have the hormones that are emitted from the reproductive organs that you're removing, right? So, for example, the incidence of canine prostatic cancer may actually be higher in dogs that are neutered. Now, whether or not there's causality there is difficult to say, because the studies to do this are very complex and require evaluation of these animals over their entire life, which could be in their teens, even 20 years old. So it's hard to get a research project going like that. But anyway, point is that there's many more diseases that can be prevented by neutering your pets than there are diseases that seem to be more likely to occur in your neutered pets. Okay, so prevention of disease is another reason. The third reason is unwanted behaviors. Males and females that are intact, dogs and cats, they act differently than those that don't have their reproductive hormones, and so those behaviors may not be desirable for people. Male cats, for example, will spray. They'll do urinate in the house, marking their territory, trying to scare away predators and attract females. Well, nobody wants to live in a house that's full of cat piss. So that's an example. Male dogs, the second they sense their females in heat, they're going to run out of the house, and there you go. You lost your dog, and now we have got an unwanted pregnancy, and so there are certain behaviors. Some male dogs are more aggressive when they're intact. For example. Anyway, so there's unwanted behaviors that you may want to get rid of. If you've ever seen a cat in heat, it's alarming if you don't know what it's like, because the cat is just screaming and screaming and screaming, acting affectionate to you, but then being very vocal. And these are behaviors that we tend not to want in our domesticated animals. Okay, so those are three reasons why you may want to spay and neuter your pets. And as far as when to perform this procedure, I mean, in general, for the females, you want to spay them before their first heat, and you also want them to make sure that they're fully vaccinated before the surgery. For the males, it doesn't matter too much, other than making sure they're vaccinated. But this will definitely cause some folks who watch this to be upset, because there may be compelling evidence to show that if we are removing the reproductive organs at too young of an age, that it is actually detrimental to the long-term health. So I don't know. The jury's still out on that. There are people who believe very strongly in both sides of this, and it's tough. There are folks who will have it where you don't spay the female till their first heat. There are some that say you should at least wait till your dog or cat is at adult age, so 1 year of age, before doing this. There's different opinions out there now, and we just need more research to figure it out. Again, those studies are difficult because you have to have one cohort of dogs, let's say, that you spay before adulthood, maybe before their first heat, whatever, and then ones that you spay afterwards at some point. It has to be kept consistent on both sides of that, and then you have to follow up those animals till they die, and that's a very long study, very expensive, very cumbersome. So it's not maybe the most realistic solution, but it's the only way we can really get the most objective data possible. Otherwise, we do the best we can with the research that we have to try and figure this out. So timing wise, it kind of depends, but in general, I still believe that you want to spay the female after vaccines before their first heat, males after the vaccines, and maybe close to adult age. Follow your vet's recommendations, of course, because their opinions matter, and they're the ones that are going to perform the procedure. Now, I do, of course, recommend vet triage, especially if you have general questions regarding spaying and neutering, all the things we spoke about on this live stream, and then post-operative complications or concerns, and any long-term from it. Yeah, so vet triage has veterinarians on 24/7 that can talk to you about this. Yeah, and so that's probably a good place to stop. I would say spaying and neutering is a commonly performed procedure. Most general practitioners can perform it. Obviously, as a surgeon, I can perform these as well. And it's up to your veterinarian whether they feel comfortable performing the procedure or not for your pet. There are some animals that are considered a bit more high risk when it comes to this routine procedure, and there are others that are not so high risk, and it all depends on what your vet thinks. So Maybe that's a good topic for another video, is to talk about the surgery itself, complications, intraoperatively, postoperatively, when you want to have a specialist spay or neuter your pet, when you don't need to. We'll talk about it. Maybe we'll do it tomorrow on June 22nd. So anyway, folks, that's it for today. Thanks for those 2 folks who attended. That's great. And it's June 21st, 7:30 in the morning Pacific time. I am flying to Austin today to speak at a conference. So we'll see tomorrow morning what time I live stream, but I'll try to keep it in the morning. I believe that Austin, Texas is 2 hours ahead of Nevada time. So we'll see. But anyway, thanks for those attending on the playback. Please support the channel, donate, share it, subscribe, all the good stuff. We'll talk to you soon. Thanks.